Hello everyone, this is Dr. Dhiraj Gupta, consultant cardiologist, electrophysiologist at Liverpool Heart and Chest Hospital. I'm recording this message for patients suffering from heart rhythm disturbances or arrhythmias, and not only for members of the Arrhythmia Alliance and Atrial Fibrillation Association in the UK, but indeed sufferers from arrhythmia problems worldwide. This is clearly a very difficult time for all of us with the ongoing COVID 19 epidemic. During this short video, I'm going to try and cover a couple of points. Firstly, does the presence of a diagnosis of arrhythmia confer a higher risk from complications from COVID infection? This is something a lot of our patients have been worried about. And secondly, there has been some speculation in the media that treatment with ACE inhibitors such as ramipril or lisinopril confers a higher risk from COVID infections, and that treatment with angiotensin receptor blockers such as losartan protects one against COVID complications. And I'm going to be touching briefly on that too. Most arrhythmias fall under the category of low risk, so such as atrial fibrillation, atrial flutter, SVT. These are all low risk arrhythmias and do not confer a higher risk of complications from coronavirus just because you happen to suffer from them. It doesn't matter if you're in atrial fibrillation now, if you're waiting for catheter ablation or cardioversion, or whether you've had it, as long as your primary diagnosis is that of atrial fibrillation or atrial flutter, then you are at low risk. On the other hand, if you happen to have ventricular arrhythmias, especially if you have an implantable cardioverter defibrillator, well, then that's a different matter. Almost by definition, your heart function is going to be compromised in that situation. And then, yes, you will be at a higher risk than if you did not have that diagnosis. So if you have an implantable ICD, then yes, you are almost certainly in the higher risk subgroup. There are some patients whose ventricular function is normal, but yet who have an ICD because of rare conditions such as long QT syndrome or Brugada syndrome. And these patients would also be at somewhat higher risk. And certainly, for example, patients with Brugada syndrome, they are well known to have a higher risk of complications, higher risk of arrhythmias if they were to develop conditions, infections that would increase their body temperature. But as a general rule, if you have a defibrillator, you're at a higher risk. If you don't have a defibrillator and your primary problem is only atrial fibrillation or atrial flutter or SVT, then you are at low risk. And what if you have a pacemaker? Well, once again, your risk of having any complications from coronavirus just because you happen to have a pacemaker are very low indeed. The only exception is if your pacemaker is that of a cardiac resynchronization therapy types or a biventricular pacemaker, then almost certainly your heart function is poor, and that's why your cardiologist has given you such a pacemaker, and then yes, you will fall into the high risk group. As a general rule, you need to stay out of hospitals whilst the coronavirus storm blows over. Hospitals are going to be hotbeds of infection. Almost certainly all physicians, healthcare workers are going to be extremely busy looking after patients with coronavirus. And you really don't want to go into that kind of a situation if you have a problem that can be managed at home. So there are some red flag symptoms that you should be looking out for. Only and only if you have blackouts, or if you have a defibrillator that starts firing and giving you shocks, or if your breathlessness gets to such an extent that it cannot be managed at home, only then should you seek medical attention, and certainly only then should you be looking to go to A&E. Otherwise, if you have an attack of atrial fibrillation, almost certainly that's going to self-resolve. Atrial fibrillation by itself is not a fatal condition, so let that not be a reason for you to go to A&E. We are all very optimistic that the coronavirus situation will resolve within a few months. Hopefully, with the social distancing rules that have now been imposed by the government and the countrywide lockdown that has been put into place yesterday, the spread of the virus will slow dramatically, and we will, without a doubt, come out at the other end sooner rather than later. I wish you all the best. Stay safe.